This is Dr. Sharad Lakhotia, past President Delhi Ophthalmological Society and past Vice President DMA. Today I am going to talk to you about glaucoma awareness. Let's understand what is glaucoma. It's a disease complex which causes loss of sight because of optic nerve damage, and most commonly it is caused by rising eye pressure. What is eye pressure?
To maintain eye in its shape, there has to be a pressure inside, that is known as intraocular pressure.
Normal pressure ranges from 10 to 15 and up to 20 millimeter of mercury. If it is more than that, it is called high intraocular pressure, which can cause glaucoma. Now, what are the types of glaucomas?
The most common type is open angle glaucoma, where the angle remains open. What are these angles? These angles are the angle between cornea and the iris, through which drainage of aqueous humor occurs. And what is a closed angle glaucoma or angle closure glaucoma? Here the angle is very narrow. So what is the primary difference? The primary difference is, and the commonest variety is the open angle glaucoma, which occurs in a normal individual, but myopes may have a higher tendency to develop it, and it does not give any sign and symptom before the damage starts. That's why a routine eye examination is very essential. It is very important that at the age of 40, when we require glasses for reading, at the same time you should also have an eye pressure checked up and also the angle of the anterior chamber done to ensure that things are okay. This is the most important awareness message. Now, in angle closure glaucoma, if it is detected in time, loss of sight can be prevented. And in angle closure glaucoma, the most important thing is it has sometimes manifestations of an acute attack, where there is sudden pain, redness, seeing halos around light, and intense headache. All these things, if they appear, they may mimic even an attack of gastroenteritis or some abdominal problem, and often they have a mistaken diagnosis. So it's very important that all these symptoms, when they appear, the patient should be examined for the rise in pressure, and if it is done, it can be again life-saving, because in acute angle closure glaucoma attack, immediate treatment has to be instituted and the pressure has to be lowered because it happens suddenly. Glaucoma can occur at any age. Even a child can be born with glaucoma, congenital glaucoma. There can be juvenile glaucomas in a younger age group, and most of the glaucomas appear after the age of 60. And a family history of glaucoma is very important. So in West, most of the countries, anybody who is found to have glaucoma, their all blood relatives have to have a glaucoma investigation done. So once diagnosed that this is a case of glaucoma, then certain investigations are to be done, like field of vision test, angle of anterior chamber, that is gonioscopy, and OCT for the optic nerve damage. Because when we are examining the optic nerve, many times what happens, there are normal tension glaucoma where the pressure is not raised, but while we are examining the retina, we suddenly find that the optic nerve, when we are looking at the optic disc, which is representing the optic nerve, the disc is having deep cup, and that it gives us suspicion. And when we do OCT, we can have a lot of information about it. So such kind of glaucomas also are to be ruled out, because they may not give any sign symptoms, nor there is a rise in pressure, and they can cause potential loss of sight. So all these glaucomas, once detected, if they are detected in time, further loss of sight can be prevented. So it is important that a routine eye pressure checkup with the angle observation should be done after the age of 40 for everybody. Even if there is a case of headache or pain around the eyes, it should be checked for glaucomas. Now, what are the treatments available? There are normal small the medicines, once a day medicine or twice a day medicine, which can control glaucoma reasonably for a long time. However, if glaucoma cannot be controlled with medication, laser treatment is available, like laser iridotomy, laser trabeculoplasty, and if need be, the surgery can be done like trabeculectomy, and sometimes even there are implant devices which can be implanted which can control eye pressure in those cases which otherwise don't respond to other form of treatment. So the message here is that glaucoma is a condition where loss of sight is preventable, and it's very important for all of us to understand. Then what are the predisposing factors? Yes, high blood pressure and diabetes are most important factors, as they are the lifestyle diseases. It's very important to maintain a good lifestyle and have a regular checkup of blood pressure as well as your control of diabetes should be done. Once things are checked in a routine way, loss of sight can be prevented. Also in hypermetro, one has to be careful because the eye is smaller in size, and here the angle closure glaucoma possibilities are higher. So depending on the type of eyes, you always have a clue that this type of possibility of glaucoma is there. So a routine eye examination is so important, and many times people think that they go to an eye optical shop and get a glass number done, and that is all about eye checkup. So it's important that a routine examination along with the glass number checkup will help you to prevent such diseases in future. Thank you very much. This is Dr. Sharad Lakhotia. Thank you.